This is the second class in our 5 series. And this is about mindfulness and movement regarding balance and fall prevention. And I have to say that I teach balance a lot and have taught balance for many, many years. But diving deeper into the research about balance and fall prevention, I learned some very interesting things around the whole system of balance. And it's actually an ecology of 3 different systems that influence our balance. And we're going to be playing with challenging our balance tonight in a way that it doesn't feel scary or threatening, but just nudges you a little bit in service of preventing falls. So that's what we're going to be focusing on. And if you weren't on the call last 2 weeks ago when I was here, unfortunately, I had to miss last week because I was away teaching at another program. But 2 weeks ago, I was presenting. And I just wanted to say that I am a mindfulness instructor as well as a yoga therapist. And I always like to do a territorial acknowledgement. I know you were talking about Indigenous concerns last week. So I did want to begin by saying that I am teaching you from unceded Algonquin land in rural Eastern Ontario in Canada. And I have explored for most of my life, what does it mean to be in right relationship with both what's going on inside of me, with the physical aspect, the emotional aspects, the hard aspects, and what's going on in the world around me. And how do I relate skillfully with both of these worlds? And that has taken me to the intersection of working with trauma-aware mindfulness, movement tailored to the needs of each person, and the power of deep nature connection. So certainly in this series, I am looking with you at the intersections of mindfulness and tailoring movement to the needs of each person. I just wanted to also remind you that it is your responsibility to choose which exercises you will do, and just to discuss any concerns that you might have about your participation in this program with your doctor or other healthcare provider. So what are we going to cover today? We're going to do a very, very brief review of week 1, where we looked at the basics of mindful movement and mindfulness, and also the adaptation of movements to light daily activity. That's what we focused on 2 weeks ago, and we will have a recording for you as part of this recording series going forward. I'll talk tonight about a balanced approach to how I'm tackling different topics in this 5-week series. And so balance comes into my approach. And then we'll talk specifically about balancing movements and how it relates to fall prevention. And we'll give you a short practice. I'm hoping to give you about a 25 to 30-minute practice. We'll just see how that goes. So the balanced approach is, and I believe it was Dr. Lee who talked about the different guidelines. And so what I'm going to be teaching you in these 5 weeks is primarily, last week we focused on light activities, and the remaining weeks we're going to focus on different aspects of physical activity, but with a balanced approach. So this is week 2, March 7th. So we're going to be focusing tonight on balancing movements to help prevent falls. In week 3, we're going to be focusing on core strength. And I think about core strength as not only our abdominals, but the muscles in the sides of our torso and the muscles in our backs, so that we really create stability in our torsos 360 degrees. And because I'm adapting this program to the needs of each individual, I'm going to make it available to people who would prefer to do this in sitting, and then make it available to people who are also comfortable going down to the floor or on a bed. And then in week 4, I'm going to be teaching you some light resistance training to get stronger in your upper body, which is sort of the shoulder and arm area, and your lower body, which is the hips and leg area. And then by that time, I think we'll decide on how we want, if there's any other areas you guys want to focus on, or if we just have a question and answer period. So we'll just see where we get to in week 5. But that's how I'm approaching this series. So let's talk about why I wanted to start with fall prevention. So 30% of those folk that are age 65 and older fall at least once annually. So 1/3 of people 65 years and older fall at least once annually. And if you fall at least once, you're 2 to 3 more times likely to fall again. And so 1/3 of the population over 65 is going to fall. Falls can cause soft tissue injuries, sprains, and muscle bruising and strains. If you fall and hit your head, it can cause head trauma, perhaps concussion. You can risk fracturing, often wrists or ankles or shoulders get fractured in a fall, and even hips. And we really don't want to fracture our hip. So, and that also creates an emotional impact when we fall, because we're very afraid of falling again. And sometimes falls can even cause death. So thinking about fall prevention is really, really important. The primary causes of falls are environmental hazards, and that can be anything. That could be a slippery mat, that can be some water spilt on the floor, wet leaves outside. It could be a pet that runs underneath your feet. It could be your footwear. I know so many people who have tripped on a curb and fallen. So there are many environmental hazards, and that's why our mindful approach, our paying attention, is so important to these hazards. Other causes of falls are alcohol and other substances. I know that many, if not most of you, are taking medication for your autoimmune condition, and that can have side effects that can make you dizzy or a little fuzzy, and so that can also put you at risk for fall. Other health-related factors include not being able to see well, not being able to hear well, inner ear imbalance, and we're going to talk more about the vestibular system tonight and how important it is to understand this system and work with it skillfully. Slower reflexes, foot neuropathy, numbness in the feet, muscle weakness, postural imbalance, and joint pain and impairment. These are all risk factors for falls. So why is a mindful approach helpful to thinking about balance and fall prevention? Well, as I said, if we think about when we've fallen, and I'm sure we've all had experience of falling at some point in our lives. I know for me, I have fallen because I'm distracted, or I'm moving too quickly. I'm not really paying attention to what's happening in the moment. And so that is why mindfulness, being in the present moment, not judging ourselves, and really getting curious and friendly with what's arising and paying attention to how we're moving, how we're walking, can be so helpful. So this is a quick review from a couple weeks ago. So how can mindfulness support balance and fall prevention? So as I said, this attitude of curiosity and friendliness. So really getting curious about the moment, how we can slow down, how we can play with challenging our balance, so that the more we challenge our balance in a way that doesn't feel too overwhelming, like we're going to risk falling by challenging our balance, but just incrementally with curiosity, carefully challenging our balance, how that can help prevent falls. The other thing is listening to your body. So we're going to do this in our practice tonight. As we challenge our balance, as we shift our posture, as we play with arm movements, feet movements, and head and eye movements, we're really listening to the body sensations, where muscles are firing, um, it, it, just paying attention to what's arising as we move through the practice. And then finally, that slowing down. So when we pace ourselves, we are in choice as to what movements and what level of intensity, how much we want to challenge our balance feels appropriate. And so I'm gonna start with some super simple stuff tonight. And then you're in choice with how much more challenge you want to add to your balance practice tonight. So here's the good news. Mindful movements that maintain and improve balance can reduce falls when practiced consistently. And movements that are done mindfully, like walking, strength training, which we're going to do in week 4, dance, Tai Chi, yoga, Pilates, and other forms of movement, they can all go a long way towards fall prevention. I think what I want to say here is that what I'm going to be teaching you tonight can be applied to any form of movement practice that you enjoy doing. So let's talk a little bit about the 3 systems that that affect your balance. So the governing system is called the vestibular system. And many people don't really know about this system. And I've certainly learned a lot more about the system in preparation for this talk. And over here, it's hard to see, but there's this very delicate group of bones that are in these semicircles, and they all are perpendicular to one another. And within these bones are fluid and hair-like cells and crystals. And when our body moves position, whether it's moving from standing to lying or shifting your balance, this inner ear system tells you how to stay in balance. It's really amazing, and it influences 2 other systems in the body. And one is your eyes, and we're going to play with our eyes tonight to help us balance. And so the inner ear system, when we move and position our head, will influence your eyes, and your eye muscles are constantly adjusting to allow you to see the world clearly when you're moving, to keep you in balance. And then the other way the inner ear interacts with our eyes is the inner ear also is sending messages to your posture to help keep you upright and balanced. So our eyes, our inner ear, and our posture all works together to keep us in balance. And we're going to be playing with this tonight. So we're going to be playing with this in 4 different ways, as ways to gently challenge our balance in a way that doesn't feel overwhelming or threatening to us. So the first is where you position your feet. And we're going to be playing with your foot position, which we're going to call your base of support. Your body over top of your feet is called your center of body mass. And we're going to be playing with how our body aligns over our feet and how we can play with that to balance. The second thing, and you can see here, here's a tightrope walker. And you can see how very naturally, and you can see this in all those old movies of the tightrope walker going across Niagara Falls. They have a pole and their arms are wide. So your arm position will actually influence easier balance and ways to challenge your balance. And so we're going to play with arm position tonight too. Head and eye movement. I'm actually going to come off stop share in a moment so that while I'm close to the screen and not further away, I'm going to show you some very simple head and eye movements we can try when I'm further back from the screen and doing some movements. And then finally, the surface that you're standing on will influence your balance. And so when we feel ready to slowly, progressively, incrementally challenge our balance to reduce the risk of falling, it will make a difference. And we're going to talk about different ways we can change our surface when we're ready to challenge our balance a little more. I'm just going to just show you while you're seeing me nice and up close here, and I'm going to take my glasses off here. So remember that all these tiny bones and all this fluid and all these crystals, when we move our head, are changing and moving and giving signals to our eyes to keep us in balance. So the thing about that is we tend, when we're balancing, to over rely on our eyes. So we tend to really, when we're trying to balance, we often fixate our gaze in one place. And that's a very effective way to keep your balance. But unfortunately, what happens if you overuse your eyes is that you don't as much use your body and your posture in order to keep balance. So what we're going to do tonight is play a little bit with our eye movement and our head movement so that when we feel ready, we can challenge our balance a little more. So what would those kinds of movements be? So remember a couple weeks ago, we talked about how to get good posture by imagining there's a little bone, a horseshoe-shaped bone at the top of our throat. And what we're going to do is we're going to very gently glide that bone back so that the ears are more aligned over shoulders. Now, if you're in a very head forward position to begin with, don't try to immediately line your ears over shoulders, but just migrate back just a little bit, and that's fine. But gently bring the top of your throat back, keeping your gaze to the horizon. So if you want to join me, we'll all do a little eye and head movement now, and then when we come to standing, we can play with it there. So the first movement with your gaze at the horizon is to keep your nose pointed forward, but just lift your gaze now up the wall a bit. Just keeping your nose where it is, but just lift your gaze up the wall. Come back to the horizon and move your gaze down without dropping your nose. So just looking down, you might even see a little bit of your nose, and you might be looking down a little bit more towards the floor. And then come back to the horizon. Now, again, without moving your nose, just try turning your eyes so that without moving your nose, you're gazing as far as you can to the right. And come back to center. And gaze as far as you can to the left. And come back to center. 2 more movements. And I was very interested to read that Paul McCartney of the Beatles does his eye yoga every morning. Okay, so we're aligning with Paul here. So let's take our gaze up to the upper right, and then diagonally down to the lower left without moving your nose. And then come back to center and do the opposite. So just without moving your nose faces forward, just your gaze up to the left and down to the bottom right. And come back to center. Okay, so those are eye movements. Now, thinking really lovingly about your neck and how much you want to move your head now from this good position, I would suggest, if your neck's feeling okay, to still keep these movements fairly minimal. And so with my hyoid back, my ears aligning more over shoulders, my chin parallel to the floor, now I'm going to just slowly turn my head to the right. Just as far as it wants to go, back to center, doesn't need to be to the full end range, and slowly move to the left. Notice if there's limitations to either side and just be curious about that. I definitely notice differences to the sides. And then still checking your good posture, try dropping right ear to the right shoulder and come back up. Left ear to the left shoulder. So as you're doing these movements, the vestibular system in your ear and your eyes are talking to one another. Come back to center. And then just very slightly, still with that really good posture, lift your gaze slightly up, maybe to where you can see the wall meet the ceiling. And then just very slightly down. And same thing, maybe the floor meets the wall. And then come back to center. Okay. So those are some of the eye movements we can add into what I'm about to teach you to gradually progress to slowly, incrementally, and safely challenge your posture. So we're going to, I'm going to back off from the screen now. You guys can stay in your chairs. We're eventually going to come to standing. But for this first movement, we can stay in the chairs, and what we're going to do is we're going to warm up our feet and our ankles to prepare us for standing. Okay, so I'm going to give you a side view of me here. Hopefully you can all hear me okay with my mic. So, and here I am in my chair, and you'll notice I have an extra chair. You may, if you have an extra chair and you feel a bit wobbly on your pins, then you may want to have 2 chairs, okay? So I'll just say that right off the bat. But we're sitting in the chair, and I'm just going to move a little bit more so you can see my feet. So we want to warm up our feet. So the first thing, you can see me sitting right back in the chair. And again, I'm reminding myself to bring my hyoid back so that my ears are aligning over shoulders. And all I'm going to do here is I'm just going to lift my toes a little here and spread them. And then I'm just going to bring the balls of the feet lightly to the floor and just slightly lift my heels off the ground. Very slight. And then I'm just going to teeter-totter back and forth. So just lift the toes, spread, come back down, lift heels, heels down, toes spread, and come back down, lift heels. Just a little warm up, nice and gentle. Then I'm just going to just slide my right leg slightly further forward. My leg isn't completely extended, but what that's going to allow me to do is to begin to slowly circle my right ankle joint. Nice, easy circles. And then in the other direction. Now, if you've had a break, a fracture in your ankle, if you've had severe sprains in your ankle, these movements might not be completely smooth, and just move in a pain-free range. And then same thing on the other side. So let's lift your left toe up and come down, and then lift heel. left toe up, down, lift heel, and one more time. Lift up, and then heel, and then just slide that leg a little further forward and make nice slow circles just to warm up the feet before we come to standing. All right. Now, just get yourself to the edge of your chair. And if you want to join me in standing, please do. We're going to be doing our balance practice in standing, either with a support of a wall, one chair, or I'm going to demonstrate with two chairs. So you can just lean forward to the edge of your chair, do a little hip hinge. Remember I showed you 2 weeks ago this hip hinge where we're just hinging at the groins, the spine stays straight. And then we just press nice and firmly down into the feet to stand. Okay, now, I hope you can see from there that I have put some masking tape down the center of my yoga mat. Wherever, you don't have to have a yoga mat, but I would ask, as we do these practices, that you're not on a slippery surface, that you're on a surface where you're not likely to slip. I'm doing the practice in bare feet. You can wear shoes, but I would suggest, especially if you're on a bare floor, not to wear socks. So we want to minimize the risk of any kind of fall by making sure we've got good connection with the ground. Now, if you like to feel really supported with the hands, I would suggest positioning yourself between two chairs, and you can have your fingers lightly on the chairs for support. Now, the position of the feet is going to influence how we challenge our balance. So let me go back to the feet as our base of support. Right now, my feet are directly underneath my hips. This is a very stable position. And in this position, the center of my body mass, my belly button, is right over top of my feet. So this is a very stable position. I'll just give you a side view. As I stand here, my belly button is right over top of my feet. So my center of body mass is over my base of support. It's very stable. In fact, so stable, I don't really feel the need to hang on to the chairs, but you might. So let's play with how the center of body mass aligns over our base of support. So I'm just going to give you a side view of me here. I've got my chair in front of me, and all I'm doing is I'm taking my belly button slightly forward of my base of support. Can you see that? And as I do that, I feel my toes gripping. I'm not going so far forward I'm going to fall, but just by taking my center of body mass a little forward, I can feel all sorts, mindfully feel all sorts of sensations in my feet, my toes, and my legs. And I'm going to come back. Now, very slightly, I'm going to come back. But again, I don't want to fall, so it's just very slightly. But even just slightly taking my belly button back, I can feel all sorts of other muscles light up. And then I'm going to come back over the center. Now, let's play with this a little more. So let's take my belly button a little bit more over to the right leg. Now, as I do that, all sorts of sensations are lighting up in my left leg. And then coming back to center, belly button over my right leg, all sorts of muscles lighting up over here as my center of body mass switches. Come back over my base of support, right over top. And one final movement you can play with, just to play with observing the sensations as you change the center of body mass over your base of support. Imagine you had a laser beam out the top of your head. And that laser beam is painting small circles on the ceiling. So I'll give you a side view of me again. So if I come forward and then a little to the side and a little back and a little around and forward, and as I keep circling, painting that laser circle on the ceiling a few times in each direction, see if you can drop your mindful attention into what's happening in your feet, in your legs, in your hips, as you change the orientation of the center of your body mass over your base of support, which is your feet. Good. And then come back to center. So now so that whole time, our base of support stayed the same. What would happen to our base of support, and you can hang onto your chairs, one or both, or wall, if you were to step your left foot forward slightly and see how I'm staying on one line, just to the left of the line, and step my right foot back. This is called tandem. And I'm still the same distance. My feet are still under the hips, but now I'm in tandem. What it looks like is this from a side view. Can you notice, as you do that, any changes in your balance? And if and when you feel ready to challenge your balance, you can walk your feet a little closer to the line in this tandem position until you're approximating more that woman on the tightrope. And just see, you don't have to come as far as I am, but you can play with how the position of your legs is affecting your vestibular system and your eyes. And then you can step it a little bit wider, and you can switch it up and try with the right foot forward. This is called tandem, and this is a way to challenge your balance. This may be quite enough. You might feel that's enough, but over time, you might play with bringing your feet closer together to that midline, and then notice what that does. So let's play with the arm position now. So we saw that woman on the tightrope. So if you want to take a tandem position that works for you, you can put the left leg forward and the right leg back. So hands on something solid is going to be the most stable. Maybe a pinky finger on either chair would be the next thing. The next movement would be to bring your arms out. And the movement after that would be to bring your arms closer in to the center of the body, maybe hands on the hips or even crossing arms over chest. So you can just play with how your arm position affects where you want to play with balance. Okay, let's try it with the other leg. So just see, and if the tandem isn't working for you, instead of feet wider apart, you could bring your feet closer together. And this again reduces the base of support. So even this might be a good place to practice your arm position. Easiest, a little more challenging still, and closer into the center of body, more challenging still. So you could do it tandem or just bring your legs closer to the midline. So now what we're going to do, I'm just checking the time. We got lots of time. You can shake that out, and we can incrementally over time, when we feel ready, challenge our balance even more. And one of them would be to go into whatever position you want to lessen the base of support and try those eye movements. So we looked up, and I'm going to play with my arms out. So we looked up, and definitely, wow, that changes things. I looked down. I looked to the side. Whoa, that is challenging things. Other side, diagonal, Both ways. Amazing. So when we play with eye position, when we play with arm position, when we play with leg position, in all these simple ways, we can reduce our risk of falling. So I'm going to go with the other leg forward, and now I'm going to pick a position that sufficiently challenges my balance without feeling overwhelming. And then I'm going to try, okay, I'm going to try hands on the hips this time. And I'm going to try that head up and down, actually moving my whole head, not just my eyes. You know, it's interesting. I don't know about you guys, but as I'm doing it, moving my eyes was harder. Oh, maybe not. I speak too soon. Than moving my head. Yeah, I have to, well, nope, never mind. So again, we want to challenge our balance, but we don't want to feel like we're hanging on for dear life for fear of falling. So there's a skill to how you incrementally add challenge. What's another way when we feel ready? Okay, well, I'm going to go back to my chosen position to lessen my base of support. And I'm going to try closing, I'm going to put my arms out to a certain position. And I'm going to try closing one eye. Whoa, I'm going to open it. Got to try closing the other eye. Should I try closing both eyes? Maybe yes, maybe no, but I'm kind of curious. So I'm going to try closing both eyes. And that definitely makes balancing more challenging. So I'm going to immediately open my eyes and step my feet a little wider. What else can we do to challenge our balance? Mindfully. And so with curiosity and friendliness and pacing ourselves and really paying attention to the sensations in our body, well, if you wanted to, you could try tandem walking, where you're walking as if you were walking on a tightrope. So tandem walking. If you feel ready, you could try walking back. It's a little harder. What else could you do? Well, you could try either in just staying stationary or doing the tandem walking. You can do something called dual tasking. What's dual tasking? Dual tasking is doing more than one thing at a time. You know how you rub your belly and tap your head at the same time? I'm going to try. You could, as you're trying out balance, you could count back from December to January. So you're counting months backward from December to January. Or you could play with, so what I'm going to do, this is called dual tasking. So you could be balancing, either walking or staying in place, but I'm just going to, whoops, well, that didn't work. I'm going to actually pass a ball from hand to hand. So again, we're challenging multiple systems here to help to be more responsive so we prevent falls. So that's another thing you could try. Or December, November, October, September. So you're doing two things at the same time, challenging your systems. So another way you can challenge your balance to help prevent falls is to actually change the surface that you're on. So right now I'm on a nice stationary yoga mat, and I'm indoors in my studio space. A great way to challenge your balance, I know it's summertime in Australia, so you can go to a beach and try these exercises on a beach or on grass. I've got a couple of pillows here. So you could do these movements on pillows just to change the surface area, to change the balance, and you could try closing your eyes here. So again, you can play in different ways to challenge your balance. So eventually, if and when you feel ready, you can actually move from both feet on the floor to progress to one-legged balancing poses. And so I'm going to finish our practice tonight with those of you who want to try to work either with hands on chairs, one finger on chairs, hands out to the sides, hands on your hips, or perhaps hands on the chest to explore one-legged variations. Now, the little sequence I'm going to teach you tonight, you'll have on recording. So if it's not available to you now, you're feeling a little tender tonight, exhausted, you feel a flare coming on, you might just want to sit down and watch this one, which would be absolutely fine to return to when you're having a better day. So this next movement is a balanced approach, not only in a balancing movement. This little series that I'm about to teach you will balance the muscles at the front, side, back, and inside groin of the muscles of your hips. This will strengthen your legs, but it will also bring more balance around your hip. This will help with standing and with walking. So when you feel ready, pick your arm position. I'm going to try out to the side here. The first movement is shifting the center of body mass, my belly button, over towards my right leg. My left leg. And then from here, I'm going to lift my right knee up. This is like the Karate Kid movement. And then slowly come back down. You may be here doing this movement. The one thing I will say is watch the level of your hips. Often when we're learning how to strengthen our hips, if we're a little weak in our hips, what can tend to happen as you raise one leg up is the hip drops out to the side. So you want to really pull and squeeze that left bum muscle so that you're upright and come back down. We'll do 3. So last one, lifting my right knee up and coming down. That strengthens the front of your hip. Now we'll stay on the left leg and bring the right leg. So shift the center of body mass over the left leg, bring your right leg out to the side and come back in. Notice I put my hands on the chair. Let's see if I can do arms out and come back in. I'll try that twice more. And I don't want to lean. I'm staying upright. I'm squeezing my left bum. Lots of sensation in that left leg as I bring my right leg out and back in. 2, 3. Now, if one was enough, great. Then you can stop. If you're fatiguing and you need to sit down, you are always in choice. You can rest and come back and join us if you wish. The next movement strengthens the inner groin. I don't know how many of you have ever played soccer in your life, but you just take your right leg and just cross the midline slightly as if you were kicking the soccer ball and come back down. Notice how I'm relying on the chairs again. So maybe I could come just to my pinky, or maybe I can bring my arms out. Ooh, 2. Definitely don't want my eyes closed as I do this. 3. And then finally, the leg goes back. 1. Not very far. You notice how I'm not hinging forward? Just squeeze my bum and back a little. 2, 3. Shake that out. If you want to try the other side with me, please feel free to join with however much you want to do. And please feel free to sit down whenever that feels like a wise thing to do. So shifting a little over onto my right foot now, I bring my left foot up. 1, 2, 3. Out to the side. 1, 2, 3. Across, like I was kicking a ball. 1, 2. I'm really feeling sensation in my supporting leg. And finally, coming with the legs straight back, torso upright, squeezing my bum so I'm not coming back very far. 1, 2, and 3. And shake that out. All right. I think that might be enough for tonight. There are a couple of balancing movements that will help us to pick up objects around the house, light objects. There's another balancing movement that helps us transition down to the ground. But it's 10-2, and I think it would just be good to sit, to rest, to have a drink of water. And we can explore those other balancing movements as we feel stronger as we go through this 5-week series. So I am more than happy to answer any questions that came up in the practice tonight.
Speaking of practice, what is a good regimen for this series of exercises?
Okay, well, there was the movement guidelines I put up in the PowerPoint presentation, and they suggest, so it's a guideline, right? And we all have our weeks and whatever, but as a guideline, 150 minutes per week of exercise, however you want to parse that out. So I always think, well, maybe 5 days a week, give myself a couple days grace, and 30 minutes physical activity per day. And what I do is I actually do balance, and then I do core strengthening, another 30 minutes another day, and then I do weight training a couple times in the week. So and I do balance almost every day, and I do core training. So stabilizing my torso in good posture, that I do that about 3 times a week. So I'm going to be giving you in these 5 weeks 30-minute nuggets that you can play with throughout your week. But again, it's a balanced approach. So we're talking about balance tonight, and it's a balanced approach. So a little bit of weights, give yourself rest days, a little bit of balance, and then core strength. And you should be getting your 150 minutes a week in a nice balanced way.